Barbara Hall has dementia, and every week her husband Tony brings her to this singing group. Part of the network of support he has built up for them both. It's help they would have benefited from far sooner had it not taken 10 years for doctors to diagnose Barbara's condition.
You don't know where you are. You can't plan because you're not really sure, well, what do you plan, you know? But it was, 10 years of total frustration, not knowing, well, what is this?
And they give me some water.
You're talking about going to the Limes now, aren't you?
I go 2 times there.
It's estimated fewer than half of people with dementia have a formal diagnosis, and the government has set a target to raise that and diagnose 2/3 of those who have dementia by next year. So it's offering a financial incentive to GPs to proactively question their patients. It means if a surgery appointment is booked by anyone over 60 and at risk of dementia because of a history of heart disease, stroke or diabetes, participating GPs will offer them a memory assessment.
Well, I'll start off first of all giving you an address to remember.
This is the kind of test they'll do, and this doctor is one of a group of campaigners who believe ambushing patients in this way is wrong.
My concern is for the patient in front of me, who's come to me about something completely unrelated, and out of the blue I've asked them whether they have any concerns about their memory. The danger with this screening programme is it will be referring a lot of people with much lesser degree of impairment who have much fewer needs.
The task of improving the health services approach falls to this man, NHS England's dementia czar. He insists the benefits of timely diagnosis far outweigh any risks.
There are probably 300,000 or 400,000 people out there, if you look at the figures, who do not have a diagnosis of dementia. And I think giving people and their families the opportunity to talk about dementia, to make it as normal to talk about memory as we do about other things, is for me something that's very important.
Having waited so long for Barbara's diagnosis, Tony applauds the drive to improve, as long as there is funding to then support those identified.
We can't spend money we haven't got, and the NHS has got lots of high priorities, so it's got to be a balance.
Timely diagnosis is the key to accessing the support that people with dementia need to live well. But it is also frightening, life-changing news, a diagnosis which must be done with sensitivity, not in response to a target.